All right, they say better late than never. And of course, let's take advantage of the less than 15 minutes that we have to discuss a few matters on health, because my guest on One-on-One is here with us, and she's none other than Dr. Agnes Binagwaho. Welcome to One-on-One.
Thank you.
Yes.
Happy to be with you.
Thank you so much. And of course, a very sincere congratulations to you on your first PhD that you just acquired from the University of Rwanda.
Thank you, but I don't plan to have a second one.
Why?
Because it's not necessary. You can do research. A PhD is just an international recognition that you are capable to do quality research at international level. Not more than that.
So you're not going back to school again? For a PhD, that is.
Life is a school.
Mm-hmm.
I didn't really went on school on a regular basis, full-time student.
Yes.
My work is a school. My country is a school. Even being here in the radio is an experience.
All right.
Is a school.
Okay. So let's quickly get into the matters that we had lined up to discuss right here. One of them, a very key issue that is happening globally and of course affecting parts of the West African nations. And this is the issue of Ebola. Now, Rwanda just survived, I must say, by a whisker from having what would have been its very first case of Ebola after the tests from one of the patients who had Ebola-like symptoms came negative from Ebola. Probably for those who didn't understand what really took place, because there was some little speculations here, some information that was probably not clear. What really happened?
So what happened, and what can happen any place in the world? Mm-hmm. Every person coming from the countries that are suffering from the Ebola epidemic, that have a symptom that could be Ebola, are put in quarantine, tested, and released only when proven Ebola-free.
Okay.
So that means even if you go to a good restaurant that is not so good that day and you vomit, you'll be quarantined. If you quarantined. Yeah. If you are, say, suspected, and we need 48 hours to get the result, that those are special exams.
Yes.
And during that time, you are treated as somebody sick. Because in case you are sick, we need to protect all the health workers, anyone that are approaching you.
Okay.
Because a person with Ebola, you don't have skin-to-skin contact.
Yes.
When it's confirmed. So during that period of unknown, you are considered as if. So, and what we do now for people coming from Sierra Leone, Liberia, and Guinea, when they come to stay in Rwanda, now systematically we put them in quarantine, 21 days. That means they are released after 22 days.
After 22 days.
Because the period of incubation of this disease is 21 days.
So it poses a kind of a challenge, because this patient, from some reports that were being reported in certain quarters, was that he voluntarily came to the hospital. So if he had traveled into the country and nobody noticed, up to the point he came himself, if this is true, then what does that mean?
So, no, now have you passed through the airport?
Yes. I saw there's an emergency clinic.
There is, a medical barrier.
Yes.
And after that, there is immigration.
Yes.
They have increased the number of workers there. They are checking your passports.
Yes.
And if you come from one of the 3 countries I just named, you are put in quarantine.
Immediately, whether you have signs or no signs.
If you come to stay, if you come to stay in Rwanda, if you come for 1 day or 2 and you are totally healthy, no fever, we can wait that you have the first symptom, because this disease is not contagious up to you start to express the disease. But we follow you every day. That's what was done before. But what is done now, since the epidemic is growing in West Africa, you are even no longer to come in Rwanda, except if you are Rwandese and you come back in Rwanda, and then we quarantine you the 22 days.
So this means For those who are coming even on official visits or even a conference that is taking place on that day, they will not participate?
No way. No, they will not enter in Rwanda.
They will not even enter in Rwanda?
No. So we have asked all air company not to board the people coming from those 3 countries.
Okay. So this follows what even Kenya has done, keeping out any citizens traveling from these 3 affected countries.
And we avoid official travel there because it's a nonsense. To contain the epidemic, we should not go in the middle of it if it's not necessary.
We're talking of going in the middle of it, and we're still flying to Nigeria, which has registered at least 11 cases. Why are we still going there?
Nigeria got 1 case coming from Liberia.
Okay.
An official from the Minister of Finance. And immediately Nigeria took all the people that has been in contact with that person and they are now quarantined. So that means they have created a safety net around them and the entire population because it didn't spread. During the time they had that person contaminate 13 others, no others. So there, the epidemic seems to be in control in Nigeria.
So that gives us confidence that we can still go there.
Absolutely.
Now let's talk about the handling of
not only that.
Yes.
We have personnel on the ground that are checking anyone boarding. You cannot board if you have fever, if you have any symptom, if you look sick.
But what if someone just doesn't want to show that because they're scared they would be quarantined?
No, because we take your temperature. You cannot, a thermometer is a thermometer. And it's a laser one. That means it just take 1 second to know your temperature. And any doubt, you don't board.
Let's talk about the measures that the ministry took to neutralize the kind of fear that probably had gripped parts of the country or some citizens when there were some rumors that we already had a case of Ebola. How did you react to that? Just take us through the behind-the-scenes incidents.
I think we react by information. We cannot avoid, especially journalists, to divulgate rumors. Our role is to just give the right information. The population is safe. All the measures, we have 16 borders. At all borders, we have health professionals. At all borders, we are going to check everyone, even from Congo, Burundi, we check people coming from even Europe, etc. Because we doesn't believe that it has to come from one corner of the world only. People are traveling so much that we need to be vigilant for each and every human being coming in Rwanda. So I think the population is safe. And rumor, we cannot avoid them. We can just tell the truth.
Okay. Now, probably the other issue would be looking at your colleagues in these 3 most affected countries in West Africa, the ministers of health and other officials dealing with this crisis, even the heads of state in these particular countries. If you had an opportunity to be among the team that would be dealing with this issue, what are some of the things that you would advise them to do?
I think we cannot talk about other countries when we don't know where they are. I can really talk very well, eloquently about my country because I know the situation. I know that we have a district hospital in each district, a health center in almost whole sectors, community health workers in village, and I use those. I don't know very well the health system in those countries, so it's just talking for talking, and I had that.
You don't like talking just for talking. That's fair enough. Now let's look at also the issues of the Millennium Development Goals, because we have very, very few days or just months to 2015, and these are targets that were set, and we said in the health sector there are certain goals and ambitions that we're supposed to meet. Let's talk about our situation as we speak today.
So for the MDGs, we doesn't have to look, we have reached them. I have to say that the target of the government are even more ambitious than
the targets, the MDGs.
There is one where we have reached 4, 5, 6. It's okay. We and the 5 we will reach it. We have reached the 4 and the 6. Now there is an area that is not really emphasized in the MDGs. That is our challenge this year.
Which is this area?
Neonatology.
Neonatology.
Newborn. Like many African countries, we have focused on saving mothers and under 5. But the majority of Rwandans are dying during the 2 first months of life.
Yes.
So this is a challenge that we want to focus before the end of 2050.
Why do you think that area has not been given much attention, or probably even mentioning? Because I'm sure most people don't even talk about that area.
Because in Rwanda, we have to go by evidence.
Yes.
And we have done a survey, and we have seen where we are. Our people are missing health and life, and we have identified that, and we are focused on this. Other countries, maybe they are still struggling with something else, or they have another area they should focus on. We know in our side that if we manage to correct that, and it's a matter to educate, to equip, and to review and focus on especially the premature babies and under 2 months. And if we manage to do that, we can have a gain of almost 3 to 4 years life expectancy immediately.
All right. Now, still remaining with the issues of these targets and ambitions, we are also staring at an issue of the aspect of the doctor to patient ratio, where sometimes a few people feel like maybe we have more patients than the number of doctors to even sort out some of these issues that we have ambitions to achieve. What's the current situation today as we speak, and what are the ambitions or plans?
So what the ambitions we have is to double the uptake of the one University of Rwanda, starting this coming year.
Yes.
So we have we graduate around 100 students a year. We will take 200 starting next year. We have reviewed our health facilities to absorb and the number of teachers. We have also encouraged private university to come. And we hope to have 2 of them at least.
By when?
Before the 2 next years.
Okay.
Because it's a matter to build, to etc. So if we do so, we are going to assure better care to our people. But there is another thing we do, and without compromising the quality, doing what we call task shifting.
Task shifting.
Yeah. We do that already, but meaning our nurses are doing more than nurses in Europe. People doesn't realize that, but also our community health workers treat at village level with quality almost 80% of the burden of disease. Small thing for sure, but small thing that can harm a lot.
How do we ensure that we don't compromise the quality, madam?
Because we supervise, we see the results, and we educate. First of all, we start by educating. We watch how they do, and after that, we supervise regularly, and we do refreshment course on regular basis. But they manage to treat all type of fever without complication. Malaria, they diagnostic and they treat it. So the major burden, gastroenteritis, pneumonia. They provide antibiotic, and they say how they did it, and they're supervised by health professionals that come to see what they do. They report on the use of drugs and for which symptom, etc. And that's something that help a lot the population.
So you haven't answered the question of the current state in terms of the doctor to patient ratio. What does it stand at this time?
What is standard at this time? We have around 1 doctor for 16, but we need to see the report of last year.
Okay.
We are graduating some now. We have some that we have sent abroad, and that are coming back. So those type of reports, we give it around December. So call me back in December. I will tell you.
You'll be back. to tell us this. All right. So let's also look at the quality of healthcare that we're getting in some of our hospitals, plus also some of the things that we are hearing being reported. And also we've sent our reporters to some of these hospitals. And we have a case of some detained patients who are alleged to have not been able to pay their full medical bill. Is this allowed? Is this correct?
First of all, it's not allowed. And when it happened, I'm informed immediately. You know that I'm a Twitter.
Yes.
We manage a lot by Twitter. Every time it happened, somebody tweets. And every time we control immediately and we go and put order. So I don't believe that it has happened now. You have a case now?
We have a case.
Where?
At Siashka, there's a report that there were some patients who are facing this particular problem.
So just tell those patients to come and see me in my office tomorrow.
So they need to see you and you'll act on it.
First of all, I have to confirm that it's not another rumor.
Okay. So if it is not another rumor, what would be the toughest punishment? What's on the ground for those who do such things?
They will do such things. First of all, we are going to compensate those patients who have no bill to pay. The hospital will care about it. So this is already some incentive for patients to come and report.
Okay.
Bad behavior, bad customer care should not be awarded. And incentive for denounce it, we are ready to do it. And if it's true, it's against all the laws. So that means it's a gross misconduct.
Yes.
And it will be treated as what the public service consider as gross misconduct.
Okay. Now, you just mentioned Twitter, and there's an initiative that you started, and that is Minister Mondays.
Yeah.
And probably this may be one of those times that you've talked about this initiative. So just to enlighten those who don't understand, what really was on your mind when you said, let me start this hashtag Minister Mondays? What was on your mind? Why did you start this?
I started this to have a global forum. Because the advantage with Twitter is that you dialogue with people in Rwanda, but in the region and also in the world. We dialogue with colleagues, dialogue. It's really an open conversation. But for the Rwandan that doesn't have access to internet, I have a number they can do, and it came as an interface like Twitter.
Yes.
And I answer to. So that means it's a dialogue where the population express what they feel, what they want, what they have as questions, they complain or they say thank you. And we discuss subjects because like the last one was the subject was Ebola.
Yes, yes, I remember.
And it was very intense as a dialogue.
And are you usually able to answer all the questions? Because we always see a lot of them coming through. But even concerning the ones that you say come on the phone, are you able to manage this?
They come on the phone as an SMS.
Okay.
So there is a storage. So I answer. For Ebola, there are some I answer the day after.
So let's talk about the let's just name 5 of the key things that you picked from the last Minister Monday that you're already acting on.
For Ebola, communication.
Yes. Okay.
So that means the population, the people need more communication, more explanation. And that's true. It's not something easy.
Yes.
To understand that you may be having the virus during almost 15 days without any symptom, without being contagious.
Yes.
And after that, the last day, it's very quick, and you are at that time you are really very contagious. Also, the fact that many people believe there is a vaccine.
Yes.
Explain that there is no vaccine. There was a lot of question about these new drugs that may be efficient. It saved 2 people in the US, but somebody in Spain didn't survive. So this is not significant. The fact also that it has not been tested and appropriately, because there is no time. What is the ethic, the value of ethics? What is the responsibility of a government? What is the part of the research and the part of one to saving people?
Yes.
So there was a lot of question and intense how to protect yourself, what to do, what to not do. It was
so communication was one of the key things that you said this I'm going to work on. Information, that is, yes. So before you continue naming the other 4, the World Health Organization said and approved this test. Do you think they rushed and probably are compromising on the health of some of the citizens who are now desperate to get this kind of drug?
No, because it's a matter that was the second thing, because communication that the drug was the second thing. It's a matter of arriving to a certain there are a certain number of steps when you do a research for a drug. They are far, but they didn't complete. And they did have it on stock. That means there is not enough. To trade, because it was not at the stage of manufacturing, even for massive human trial. But if it's not dangerous, and if people are informed about the risk, if the drug is given with the respect of ethics and the right of the patient has the right to have it if the patient if the drug is available and the patient fully informed. So that's, I think, are the recommendation of WHO. And it's totally normal. That means the person, as an adult, make a consent agreement. They consent. They voluntarily say so that they want to do it.
Okay. Now, you are remaining with the 4 other key things.
The 4 other thing was what happened in a plane. If somebody happen, and the risk to be infected inside a plane is quite not significant. And there was a dialogue about that. Traveling, etc. And also about why this epidemic is stronger than the previous one, because normally 2 months that type of virus doesn't survive passing from a human to a human. The disease normally die by itself. And also what happened to the people that are surviving this infection, how long are they still contagious? For men it's 8 weeks, etc. So there was a lot of dialogue and what to do,
around
how
that.
The country is ready, what have we done. So we explained that throughout the country we have district hospital. All district hospital has the create a ward to.
So they have all these hospitals in the district have isolation wards.
Yeah.
Okay. So the other remaining 3.
Oh, I think
items?
I have said 5.
You've only said 3.
No. I have talked about the drugs, the travel, the information, the readiness, and what happened.
One more.
What happened when you survive?
When you survive.
Yeah.
So is it possible to survive this? Because this is part of information that people are asking, and there's that misconception from your doctor perspective. Is it possible to survive?
Yeah, absolutely. So it's not 100% killing disease, but the rate of death is very high. It's between 60 and 90%.
Okay.
According.
Let's go back to our hospitals and the situation there, especially on the issues of remuneration at public hospitals. Have you heard about this? Some concerns sometimes that the issue of payment of the nurses versus the doctors, and could it be compromising sometime or somehow in some of the results that we see from some of the hospitals in terms of the treatment and care of some of our patients? What is the situation like in terms of remuneration today?
I think the remuneration is according to the knowledge get during education. You pay a skills. So a nurse is 4 years after education, a doctor is 6. And the level of education, the scientific knowledge again, and the hands-on skills are totally different. That's what we pay. So people we cannot, in my point of view, we are not in a rich country. I think everybody will love to have a bigger salary. But the salary, according to the level of the country, the health sector receive is quite fair.
And how about the decentralization of some of the facilities that we have? Even if we don't have the exact same facilities that we have in town, in the rural areas, how are we dealing with that issue? Because if you go to some of the rural areas, you will not find a hospital like King Faisal or of the standards of King Faisal. how are we working on that decentralization aspect without compromising on the quality of service that we have?
But I think you can go and see. Have you visited our district hospitals?
On all districts, of course, I can't be able to.
No, but you have
all
visited. I think those are facilities with the number of wards, the qualified people, and I think the level of care is the capacity to provide care is good. Now, what I can say, if the level of care an individual gives to you is not, you are not satisfied, just complain. We have the number 114. Just use it to express what happened to you. We cannot say that all professionals are have the good customer care and the good behavior, even the good professional behavior. But if you don't denounce, don't go home and complain. If you want that next time you are taken correctly, claim for your rights.
Claim for your right. This is the message you're saying. So let's look forward from here now. What are your next immediate plans, or what are you seeing in terms of Rwanda's health status?
So our major objective is in terms of human resource to continue to educate and have 500 specialists, educated 500 specialists. We are the third year, so we are going to graduate. In 2 years from now, we are going to produce more because now they are in education. We collaborate a lot with the Minister of Education to strengthen the university to be capable to produce the professional we need. Starting next year, we are going to next year we are going to produce 900 nurses a year in one. And soon we hope to produce 400 doctors a year. It's still not enough, but it's still it's already a big improvement because it will be 4 times what we have. The problem is that we need 6 years to produce a doctor. To produce all these doctors. So we will start, but in the coming years it will come. We are also decentralizing more the tertiary care. We are creating 3 new teaching hospitals, one in Kibungo, Kibuye, and Ruengeri. So it's time to build, to create, and to staff. It will take time, but it's on the way. We are between the district hospital and the teaching hospital. We create another level. What is the provincial hospital? It will be Bushenge, Ramagana, Kinihira, and
so a lot of plans in adding these things. Yes,
they're all going on the same. You know, in Rwanda we do everything at a go.
Okay. So in finishing, Madam Minister, there are those probably who want to know your lighter side of Madam Binagwaho. What are some of those things that you probably think most people see you and they don't know about you, but you have fun doing them? What is that thing?
I have a lot of fun in my life. First of all, even my job is a fun. I love my job, so it's fun. Family life is fun. Dancing is fun.
So you love dancing. Okay. Which music? Which type of songs? Which type of music?
Move, the one who make you move, and so I love a lot of things. Okay. I love eating. I love dancing. I love holidays. I love my family. I love my grandchild. I like traveling. I like discovering. I love research. Okay. I love doing research. So I love so many things.
So many things. Especially the dancing part. I'm sure that those probably who don't maybe are not so close to you, maybe they're feeling surprised at this. Sometimes probably, do you think that people misjudge you? They feel like you are a tough woman and you can't do such things.
At work, I don't care. Because I'm there to work. I'm not there to dance. I'm not going to dance at work. So if they don't feel that I can dance, that's not a problem. My problem will be that at work they feel that I cannot work. Okay. So that's not a problem.
Thank you so much, Madam Minister, for gracing One-on-One today.
Thank you for having me. It was my pleasure.
Okay. Thank you so much. And there you have it. Minister Binagwaho right there at One-on-One. Thank you so much for listening. Thank you so much for your comments. Let's keep the conversation going on Twitter. The hashtag is 101RW. See you again next time, same place, right here on Contact FM. Goodbye for now.